Press OK to calibrate into the system.
AIMS Core CPR Trainer provides AHA 2010 standards of hands-only CPR.
Align your body to match the silhouette by raising one hand into the air. Place both hands on the mannequin's chest with your shoulders over the calibration complete. Press OK to begin training. You have just witnessed a person collapse on the sidewalk in front of you and they appear to have stopped breathing. I need you to perform CPR and fast. I will be here to help. But first, assess the scene. Then make certain you check for responsiveness and ask someone to call for the emergency medical services. Your training begins now.
Are you okay? Call 911. Get an AED.
Ensure your elbows are locked.
The trainer measures several things, one of those being compression depth, rate of compression, rolling of the chest, and much more.
Excellent. Keep it up. Keep it up. Keep going.
Once complete, Amy then calculates the score and gives an after-action report for the user to review.
Great job. You may now proceed to the main menu, or allow a new user to proceed. To compress the chest, push down 2 inches and then lift, allowing the chest to completely recoil. Press OK to calibrate into the system. Align your body to match the silhouette by raising one hand into the air. Place both hands on the mannequin's chest with your shoulders over the mannequin and your arms locked. Make sure the mannequin's chest is calibration complete. Press OK to begin training. You are arriving on the scene with an AED. With your training in mind, use the AED to deliver a shock to the patient. I will be here to help. But first, assess the scene. Check the patient for responsiveness, and call for 911. Your training begins now. Ensure that the scene is safe to use the AED on the patient. Be aware of the electricity generated by the AED. Do not use the AED if there are combustible gases or liquids nearby. Make certain that the patient is not laying on a metal surface. If the patient is in standing water, drag them to a dry area, and dry them off. This is specifically important in drowning patients.
Are you okay? Call 911.
Turn on the AED. Remove the adult pads and scissors from the AED kit. Clear and dry the patient's chest where the AED pads will be placed. The AED will analyze the rhythm of the patient's heart through the pads. To do this, the pads must be able to firmly stick to the patient's chest. Remove, cut, or rip the clothes from the patient's chest. Dry the chest of sweat or other liquids. Note that you only need to dry the area where the pads will be placed. Shave away excessive chest hair. Remove nitroglycerin pads, nicotine patches, or other objects which may obstruct pad placement. Ensure that the AED pads are placed according to the diagram. Place one pad on the patient's upper right chest near the collarbone. If a pacemaker is present on the upper right, place the pad 1 inch below the pacemaker. Place the other pad on the patient's lower left side chest wall. Ensure that both pads are sticking firmly to the patient's skin. Make certain the pads are not touching anything metal, such as jewelry or the wiring in a bra. Plug in the pad cable connector. Analyzing rhythm. Everyone stand clear. Shock advised. Charging. Everyone stand clear. Shock is ready. Press shock on the AED to deliver the charge to the patient. Shock delivered. Begin 5 cycles of compressions and rescue breathing. Let's assume you've just completed 5 cycles, or 2 minutes of CPR. The AED will now reanalyze the rhythm of the patient's heart. Analyzing rhythm. Everyone stand clear. No shock advised. Check the patient. If they are not breathing or show no signs of life, continue performing CPR. Great job! You may now proceed to the main menu, or allow a new user to proceed.